Thank you very much for joining our February information exchange meeting. We will be talking about type 2 diabetes, and our speakers will be able to give you a short presentation on causes and risk factors, treatment, top tips on how to manage it. We'll be talking about local services, how people can access them, and what support is available. And I'll shortly give the word to our speakers who will present themselves. But before I do, I would like to let you know that you will be able to ask your questions at the end of the presentations once they're all finished. For those of you who join us from their landline, if you want to unmute yourself, please press the star button and then number 6 from your keypads. This will enable you to unmute yourself and ask your questions. If you have any questions while speakers are presenting, please use the chat button below, and we'll make sure that we read those questions. If we are unable to answer all your questions at this meeting, we'll be able to pass them on to the speakers, and once we get their responses, we'll be able to forward those to you. I hope that's all clear. Any questions before we start? No? Perfect. Then I'll give the word to our first presenter, Lorna. She is from Diabetes UK, and she'll be talking about causes and risk factors and symptoms of diabetes type 2. Thank you very much, Lorna, for joining this meeting today.
Thank you. I'm just going to share my screen quickly. Yeah, I hope you can see it okay. So hello everybody, my name is Lorna, and as Canaria said, I'm from Diabetes UK. I'm going to be talking to you today a little bit about what type 2 diabetes is and some of the risk factors and symptoms to look out for. And also I'll give a brief overview of some of the different things that Diabetes UK has on offer to support people living with and at risk of diabetes. So just to kick things off, just a short slide on what diabetes is. So diabetes is a condition where the amount of glucose in the blood is too high because the body isn't able to use it properly. So insulin is a hormone that helps the body to use glucose and is made in the organ called the pancreas. So in someone living with diabetes, either the pancreas doesn't produce enough insulin or the body isn't able to use the insulin that it makes properly. So in the UK, currently 4.9 million people are living with diabetes, and we predict that that number is going to increase to around 5.5 million by 2030 if further steps aren't taken to support people from developing type 2 diabetes. And in City and Hackney, 6% of adults currently live with diabetes. So there are two main types. So around 8% of people who live with diabetes have type 1 diabetes. Around 90% of people, so the vast majority of those with diabetes, have type 2, and around 2% of people with diabetes live with rarer forms. So as I've just mentioned, the two main types are type 1 and type 2 diabetes, and there's sometimes a bit of confusion about the two different types, so I'm just going to briefly run through some key differences. So in type 1 diabetes, generally it's a very quick onset condition, and it's where the body produces no insulin, so it needs to be treated with insulin injections. Whereas in type 2, it can have a much slower onset, and where the pancreas might not produce enough insulin, or the insulin isn't able to be used by the body properly. And depending on the person, it can be, and their individual circumstances, can be treated with diet and physical activity or different combinations of medications, and including insulin in some people. And in terms of the causes and the risk factors, in type 1 diabetes, the cause is mostly unknown, but it can have a genetic factor to it. But it could also be brought on as a result of a viral or different infection. But for type 2 diabetes, it's quite a range of different risk factors that increase your risk of developing type 2 diabetes. So if you're over the age of 40, or for people from Black and South Asian backgrounds, if you're over the age of 25, you have an increased risk of developing type 2 diabetes. Also, if you have a family history of type 2 diabetes, so if, either of your parents or you have siblings with type 2 diabetes, that also increases your risk. If you are from a Black or South Asian background, that also increases your risk of developing type 2. And if you're living with overweight or obesity, that's a risk factor. as is an increased waist circumference. Also, if you have a history of living with gestational diabetes or high blood pressure, as well as the other conditions that I've listed on the screen here, these are all factors that increase your risk of developing type 2 diabetes. So Diabetes UK has a tool called Know Your Risk that you can find on our website, which allows you to answer a few different questions related to these factors on the screen here. And from that, it will give you a score related to your risk of developing type 2. And if you're found to be increased or high risk of developing type 2 diabetes, you're currently able to self-refer to the diabetes prevention programme. And we have Billy from Zyla Health on the call here today. So he'll be talking a little bit more about the diabetes prevention programme and how you can access it. So there are a few symptoms that you can look out for if you that might mean that you've developed diabetes. So if you find that you're going to the toilet a lot, especially at night, or you're feeling really thirsty, more tired than usual, if you find that you're losing weight without trying, or if you're experiencing genital itching or thrush, you might find that any cuts and wounds that you have take longer to heal. And you also might see that you have blurred eyesight or increased hunger. So it isn't to say that you need to have all of these symptoms to say that you have diabetes, but these are just a few different things to look out for that may indicate that you have developed diabetes and to go speak to a healthcare professional. And Diabetes UK have a great little animation video that covers the different signs and symptoms and the key differences of type 1 and type 2 diabetes, which unfortunately don't have time to run through today, but I'd encourage you to go and have a look at the video. It's in the link here, which I believe you've all been sent in the slides before. So I'd encourage you to watch that and share that with your family and friends as well. So that was a very brief overview of what type 2 diabetes is and the different symptoms to look out for. So now I'm just going to go through a few slides highlighting a few things that Diabetes UK have on offer to support people. So we have a range of printed resources that are available to order for free from our online shop, and you can also download them, many of them electronically as well. So these cover a range of topics such as support on eating well, and including culturally specific guides for South Asian and Afro-Caribbean diets, and also advice on moving more and specific guides tailored to the different kinds of diabetes. So you can access these by using the link on the screen here. And so, as I say, all free to order, but there might be a small charge for postage and packaging in some cases. And we also have lots of information on the Diabetes UK website, including our learning zone. This is our online self-education, self-management tool for people with diabetes. And so you access it using the URL on the screen. And what you'll be invited to do is to answer 3 questions about your relationship to diabetes. So whether you have type 1 or type 2, what kind of medications and how you manage your diabetes, and then it will tailor the different modules to your relationship to diabetes. And healthcare professionals are also able to log onto the platform as a professional to explore the platform before recommending to the people with diabetes that they see. And a few areas of additional support are on the screen here. So we have a helpline, which is open Monday to Friday, 9 till 6 with trained counsellors. So any questions related to diabetes, people are able to get in touch. We're not able to offer specific medical advice, but we can signpost to some key areas of support. And you can also get in touch with the helpline by email using the address on the screen here. We have our local support groups and online forum where people can get peer-to-peer support on various different topics related to diabetes. And you can find out more about these on our website by going onto the Diabetes UK website and using the search function to find these. And you'll be able to find your nearest group via this method as well. And as a London regional team, we've been holding monthly webinars for the last 2 years related to different aspects of diabetes care. So last week we had one about diabetes and preparing for Ramadan, and we're currently in the process of pulling together our March webinar, which will be looking at diabetes and women's health. So the topics are quite varied and change month to month, and absolutely free to register. And if you're not able to attend on the day, by registering, you'll receive a copy of the recording to catch up at your own time. So you can find out more about this on our website as well. So thank you very much for listening. I've put a few links on the screen here. So the Diabetes UK website, where you can find lots more information, and I'd really encourage you to go take a look, because I appreciate it's been a bit of a whistle-stop tour today. And also, as a London regional team, we're on Facebook and Twitter, using the handles here. And if you have any questions at all for the team, please do get in touch at london@diabetes.org.uk. Thank you very much.
Thank you very much, Lorna. Very useful information. Just to let you all know that at the end of the meeting, all the presenters' slides will be shared with you, as well as the link for to watch the YouTube video as well from this meeting. And I will let our next presenter, Billy Goldsmith, to introduce himself and do his presentation. Over to you, Billy.
Okay, hi everyone. Sorry about that. Just getting used to Zoom. So my name's Billy. I'm from Xyla Health and Wellbeing, and I work on the diabetes prevention program. So the diabetes prevention program is can everyone see that okay? If you just give me a thumbs up.
Yes, we can.
Okay, perfect. So it's a commitment from NHS England, Public Health England and Diabetes UK, just to tackle the amount of type 2 diabetes that we're seeing at the moment. And this is currently available across North East London, and it's totally free. Xyla Health and Wellbeing are one of the largest providers of the programme. So obviously, like I said, we will provide that all across North East London. Currently, at the moment, we're doing that remotely or digitally. So we'll come on to that in the next few slides. And the hope is that from April, we'll be starting to deliver those sessions face-to-face again. So I know this is a bit word heavy, but if we just go over the kind of referral pathway. So previously, what would happen is you could have a blood test done with your GP, a blood glucose test. And if your results come back between 42 and 47 millimoles in that pre-diabetic range, your GP could say to you on the day, okay, you're in the pre-diabetic range. What I can do is refer you onto a program called the Diabetes Prevention Program, and they will use a form that's embedded in their clinical systems to refer you. Alternatively, if you'd had a blood test with your GP in the last 12 months, or at the moment 24 months, you could receive a letter in the post just saying, look, 6 months ago, you had a blood test, these were your results, you're eligible for a diabetes prevention program due to you being at risk of type 2 diabetes. And then what would happen is they would send you a link with your result, and obviously you have your NHS number, and you would refer yourself online. But what I wanted to talk on, and what Lorna kind of briefly mentioned, was the Know Your Risk tool that we're using at the moment. So that's a really easy tool that we're using, where a blood test isn't required at all. And it's just a very simple questionnaire that you can do online. So basically how that works, as you can see, is you'll have a questionnaire which basically will look at, your kind of age, family history of diabetes, ethnicity. They'll take measurements of your height, waist, and your weight. And what will happen is that'll be a point-based system. So you'll be scored on your risk of developing type 2 diabetes. And anyone that receives a score of 16 and over will be eligible for the program. And what should happen is you should be automatically directed to our referral form. So obviously, once you kind of see the slides afterwards, you can access the questionnaire on the links there. So our website or the Diabetes UK website. And just to give you an overview of how that actually looks on our website. So it's very easy to find. You can select the language that you'd like it to kind of be displayed in. So if you go onto the Know Your Risk tool, what will happen is it will take you straight to the questionnaire, which you can just see a little snapshot of. And then from there, if you aren't directed straight to the referral form, you can see on the stage 3 there, if you know your risk already, you can register. And in the bottom right, you can just see a snapshot of what that form would look like. And all you need on there is just general information about yourself and your GP practice that you're registered to. So in terms of the patient journey, what would happen is from signing up to the program, you'll hear from someone in our patient support team. They'll give you an initial assessment just to work out what your motivations are, what your goals are, demographics of where you're based, what kind of groups you'd be interested in, all male groups, all female groups, language-based groups. And then from there, with the remote structure that we're running at the moment, it's all group based. And following on from that, you'll have an end of program review. So a little bit of a breakdown. So what would happen is you'd have 13 sessions over the course of 9 months. So you'd have 5 eating well sessions, which is very much nutrition based, 4 moving more sessions, which are basically based around physical activity. And then you'd have 4 taking charge. So that'd be the kind of behavior change aspect of the program. Each session typically is around an hour, just over an hour. The physical activity sessions are about 45 minutes. And what we also offer, so at the moment with the program being remote over Microsoft Teams, we do also offer a completely digital service, and that's provided by Aviva. So that'll be an app that you can download on your phone. And what will happen is this will just give you the chance to complete the course at your own pace. You'll still have access to a health coach, but obviously it just makes it a little bit more flexible. And if you're someone that likes to learn one-to-one as opposed to a group setting, this may be ideal for yourself. And obviously we try to select kind of all of our classes with kind of taking into consideration different language needs. So what we have in the company is tons of bilingual coaches, and they will be able to offer classes based on, language preferences. And you can see on the screen at the moment, so Polish, Punjabi, Arabic, Hindi, Urdu, Gujarati, Bengali, Portuguese, and Farsi. They're our most popular languages at the moment across the program. And just to kind of finish up on looking at the outcomes of the program. So this has been taken since 2016, and this would be in relation to over 80,000 patients. And what we've seen from people that complete the program is 76% actually reduce their blood sugar levels, so that HbA1c, and that's on average by 2.4 millimoles. What we can also see as well is there's some evidence of less unnecessary hospital admissions. It's taken some of the stress away from GPs. And although we're not a weight management program, we're more about lifestyle change. Consequently, because of these kind of behavioral and lifestyle changes, we do see 79% of users actually reduce their weight. So 40.6% of those would lose up to 5% of their body weight. 12.5% have lost 10% of their body weight. And that's it. So like we said, if there's any questions, feel free to either send them over or we can go through them at the end. And thanks for listening.
Thank you very much, Billy. Great achievements, by the way. Well done.
Cheers.
Well done on this. So our next presenters will be Bayap Mistry, who is the lead diabetes dietitian at Hamilton University Hospital, and Dr. Shane Mehta, who is the GP clinical lead on diabetes from NEL Clinical Commissioning Group. I'll give the word to you. I'm not sure who wants to start presenting first. Dr. Mehta?
Yeah, Dr. Mehta is going to present first. Thank you.
Excellent. Thank you. You are on mute, Dr. Mehta. You are still on mute?
I think I'm unmuted now. Can you see my screen and the slides?
Yes, we can.
Thanks. So thanks for the introduction. Yes, I'm Shane Mehta. I'm a GP and local diabetes lead, and I'm joined today by Viv Mistry, the diabetes dietitian at the Homerton. So I guess in this short presentation, we're going to try and give you a flavour of some of the local support services we have locally, and also give you some tips on how to best manage your diabetes to get the best out of your local healthcare team as well. I mean, we know that living with diabetes can be complicated, and the good news is that locally there's lots of support available. Your GP, local pharmacist, and we know that in each practice in City and Hackney, we have a diabetes nurse specialist and specialist diabetes dietitian that can also help if you're struggling with your diabetes. The primary care team is growing each year, and this year we've had the addition of new members, health and wellbeing coaches, as well as social prescribers who can help signpost to other services that may be able to help you around diabetes management. Hackney Diabetes Centre provide a variety of free structured education courses for patients with type 1 and type 2 diabetes, as well as covering elements of prevention. The idea of diabetes structured education is to equip patients with knowledge, skills, and the ability to self-manage diabetes. We can share some more specific links on how you can access these courses after the talk. So what can you do to stay healthy? One of the main things that you can do is to make sure that you attend for your annual health check. Your primary care team should invite you at least once a year for this, and it normally takes place in 2 parts. So part 1 includes the tests that you can see listed here: a blood test, a blood pressure check, a foot check, and a urine test. Part 2 will usually be an opportunity to review these results and discuss the results of these investigations with a healthcare professional who has expertise in diabetes. This could be a GP, an experienced nurse, or an experienced pharmacist, for example. The idea here is it's an opportunity to discuss any medication-related issues, as well as an impact on how diabetes may be impacting on your own well-being or your mental health, for example. There are lots of support services that we can link you into to help and support. So do take this opportunity to discuss whatever's troubling you or concerning you in relation to your diabetes with your healthcare team. It's an opportunity to discuss any sexual problems. For example, if you're experiencing erectile dysfunction or vaginal dryness, we'd encourage you to talk to your healthcare professional about this at this appointment. One of the things I always encourage patients to do at this appointment is to think about their personal goals. What's important to you in terms of your health and your own needs in the next 3 to 6 months? Of course, the idea is to make this as specific to you as we can, and it's a chance to form a plan and go away with a care plan at the end of this to really optimize your health and best control your diabetes. When you have type 2 diabetes, it's really important to take care of your feet. Your primary care team will usually check your feet once a year using a special device to check the sensation in your feet and to check the general health, as well as the nail health, the circulation in your feet. If there are any concerns, you'll be referred to see a podiatrist. This is really important, as in England alone, there are 150 toe or foot amputations per week. And the idea is that if we recognize problems early, we can prevent these. We'd encourage you to check your feet daily using a mirror if needed to help. In City and Hackney, we have access to an emergency foot clinic during the week at St Leonard's Hospital. Make sure you know how to access this in case you need. We can circulate some information about this after the talk. They usually are able to get you in for a same or next day appointment if there is an urgent foot problem, for example, a foot ulcer or a new cut or injury. And it's important that you seek help promptly if these occur. Each year, you'll be invited to submit a urine test. It's called a Urine ACR test. Now, this isn't a check for infection, it's a check for protein in the urine, because we know that protein leaking from the kidneys can be an early sign of kidney disease. And the idea is that through testing your urine each year, we pick this up early. There are simple medications that can then be started to reduce further damage to the kidneys, and it's a chance to think about what else we can do to help. We know that through this process, we can reduce risk of progression of kidney disease and the progression to things like dialysis. Your blood pressure control is really important when you have diabetes, and generally, we'll aim for a blood pressure less than 140/90. However, this is personalized depending on your health, so you can discuss your individual target with your doctor. Good control is important as it reduces the risk of heart disease, strokes, as well as complications with your kidneys. Blood sugar. Testing your blood sugar is important when you have diabetes. In general, for most people, we'll use a test called the HbA1c. This is a specific blood sugar test that generally gives us a 3-month average reading, and the average is what's generally most important. So most people will not need a blood sugar testing monitor at home, because this only tells you what your blood sugar is in the moment at that specific time. If you do need blood sugar monitoring at home, your healthcare provider will normally provide you with the machine and show you how to use it. The good news is that there's lots of different medications that can support with keeping your blood sugar in range. It's not just metformin or insulin, and your healthcare provider will work with you to find the best medication for you. It's really important to know your HbA1c blood sugar target. This is individual and specific to you, and I'd encourage you to ask your healthcare team to write this down for you in your care plan, or give you the healthcare target so you can make a note of it. This is really important as good blood sugar control reduces the risk of complications, including infection. Your blood cholesterol will also be checked on that annual blood test, and your GP will use a risk calculator to look at the cholesterol level, and in many cases, a statin might be suggested to help lower your cholesterol. This also reduces cardiovascular disease, so strokes and heart attacks, reducing the risk of hardening of the arteries. The idea is to reduce the bad cholesterol and perhaps focus on improving the good cholesterol. Diabetic eye screening is really important. Now, this isn't something that's usually organized by your GP, but you'll be invited by your local screening service for a special annual eye check. This is different from your usual trip to the optician and is not something that the high street optician usually carries out. The idea of diabetic eye screening is to look at the health of the back of your eye. Even if you've got no problems with your vision and your sight is working perfectly well, it's really important to attend for your diabetic eye screening, because this is our way of detecting early signs of sort of silent eye disease or eye damage, allowing earlier treatment and ultimately preventing blindness. Treatments include laser treatment and eye injections. So the annual health check is really, really important because it allows us to detect things early, act on them, and also it's a chance for you to discuss any issues you may be facing with your healthcare team. Aside from this, there is lots and lots of other support available. We know that diet and lifestyle can have a big impact. Even a small reduction in weight through exercise and reduced calorie intake can improve diabetic control and reduce the risk of complications. The good news is that locally we have specific weight and diet programs that can help. Some of our practices are taking part in the low-calorie diet program. This is part of a national trial looking at pushing diabetes into remission and allowing some patients to stop certain medications that they may be taking for their diabetes. This is something that requires a lot of supervision and support, but if you are offered the chance to take part, I'd encourage you to consider this, as it's really exciting and it's a very new thing that's based on research that's been done in recent years. But for all patients with type 2 diabetes, we have access to services for like Healthier Together, where you can access gym and exercise support locally, and also digital weight management programs, for example. Aside from that, there are local, more informal walking groups that are run by the Diabetes Centre, as well as with health and wellbeing coaches in every practice in City and Hackney. We can circulate some more information about how to access these specifically, along with information after the talk. The council have also produced a Find a Support Service guide. This is something that is searchable and can look for services that can help with a range of things to do with exercise and well-being, art and creativity, as well as looking for specific services for those with mental health issues or anxiety, for example. We'll share the link to this as well after the talk. So key take-home messages from me are that the diabetes annual health check is essential to maintaining good health, and making small changes to diet and exercise can have a massive impact on how well your diabetes is controlled. And there are lots and lots of free NHS support services available. So I'd encourage you to access these locally should you need. Thank you for listening.
Thank you very much, Dr. Mehta. Excellent, excellent presentation and information. I wonder if Mystery would like to say anything, or was that all that you?
Hi, yeah, no, I think Shane's covered what we do quite well. So I'm for everybody, sorry. a bit late in joining. I've just realised my camera wasn't on. Yeah, so as Shane said, the diabetes service is where our mothership is. We're based at the Diabetes Centre at the Homerton Hospital. Each practice has a diabetes nurse and dietitian there. So we often see patients who, you know, at the moment have been really struggling with their diabetes, particularly during the pandemic. But if you are concerned, then do let your GP know. And as Dr. Mehta also said, we do do lots of courses for people with diabetes, so to suit people's needs. So we've been doing things during the pandemic. We've been doing a lot of things online, virtually, and also we've been starting to do things face to face. We also have a walking group that comes to the Diabetes Centre every Monday morning, and you don't need to book. I think we're sharing that information afterwards, aren't we, Shane? So we've got so your GP can refer you to our education programme, or we've got a self-referral form that if you want to refer yourself to our courses, you can do that also. And there's a walking group here on a Monday morning at 10, which, you know, there's lots of walking groups in Hackney, which would encourage you to join. But if you at our one, we check your blood glucose levels before you go and when you come back, and, you know, support you with any hypers that you know, if you're concerned that you might have that. So there's people around you who can help you with that too. Yeah.
Thank you very much for that. Thank you. Yes, we'll definitely share slides and presentations after the meeting. And if you think that there is any additional information that you think residents will benefit from, please do feel free to send it to me by the end of the week, and I'll send it across. And we were talking about making small changes to diet, and luckily we have Caroline Stacey here from Backs of Taste. Caroline, would you mind maybe just for a couple of minutes before we start taking on questions, to say a few words about Backs of Taste and how people can benefit from Backs of Taste? Oh, you are on mute, Caroline.
Okay, hi everybody. Yes, we're one of the many voluntary organisations working within Hackney, although we're actually national. It's a behaviour change programme, encouraging people to cook more from scratch, change their eating habits on a very low budget. So I don't know how many people here have come across us before and what we do. We've been going since 2014, I think. Used to run physical classes, and we've now converted, because of the pandemic, converted all our courses to remote ones where we support people in small WhatsApp groups of 2 or 3 students, we call them, with a mentor who guides them through the WhatsApp, or if they don't have WhatsApp, by phone, one-to-one mentoring we can provide through cooking 3 recipes. Always the same recipes. This may be familiar to you, the chana masala, Italian pasta sauce, and a Middle Eastern pilaf. And we help people with the skills. We give them a knife sharpener, we show them how to chop an onion, give them the skills and confidence and some recipe ideas for cooking healthy meals on a low budget. We've adapted our program. We're now asking people if they have diabetes, and we can adjust the ingredients we provide them. So we provide them all the ingredients for the 3 recipes free, deliver them to their home, and then start them off with the cooking. We've now got so special resources for people with diabetes. So we've substituted the carbohydrates. So instead of rice for the chana masala, we give them brown rice and cooking instructions for that. We give them whole wheat pasta, and we give them bulgur wheat for the pilaf. So we take referrals. What works best for us is if somebody who's got a diabetic patient or diabetes centre, somebody particularly, or really for people on very low incomes, refers someone to us, and I can give my details are sort of all over the place, all over our flyers. I can leave flyers, for instance, at St Leonard's. I know most of the social prescribers in Hackney know us and do refer to us, but I think perhaps people aren't aware that we are now even more suitable for people with diabetes. And people who come on the course, we have very, very good outcomes. So people save money, eat better, feel better after the course. So it's having an impact.
Excellent. Thank you, Caroline. And would you accept self-referrals as well, or that should be on?
Yes, we absolutely encourage self-referrals, but they happen less often, and then it doesn't work as well. You know, nothing there's nothing better than somebody explaining to somebody how it works to start with, giving me the person's number and I call them and then get them on the program. If you hand someone a flyer, they're less likely to refer themselves than they are coming from a health professional or someone.
Okay, we'll make sure that we share information about bags of taste in our post event.
Well, I'll put it in the chat.
You can as well, you can, yes, definitely. Thank you very much,
I think
Caroline.
many of you are already on my referrers list. If you would like to be added, please send me your email address in the chat and I'll make a note of it now.
Perfect, thank you. And
Excellent.
now we will move to the questions in the chat box. For those of you who join us from your landline, if you have a question, please press the star button and then number 6 from your keypad. So that will unmute and you'll be able to ask your question. Okay, so the first question in the chat box is for you, Billy. And Nasima is asking if there is the criteria. Hi, Neka Odumodo. Hello. Okay, I think, all right. So Billy, the question is for you. Are there criteria, is there a criteria for failure program?
Yeah, apologies about that. Just being conscious of time, I'm aware that I may have skipped over some of that. So generally speaking, you have to be 18 and over to join the program. The HbA1c level should be 42 to 47.9 millimoles. So it's a pre-diabetic program. And in old money, that'd be 6 to 6.4%. We accept a fasting plasma glucose of 5.5 to 6.9 millimoles. Both of those can be in the last 24 months, but just to let people know that as of April, that will go back to 12 months. You cannot be pregnant in the time of starting the program, and you must be registered to a GP. And in terms of the know your risk, like I mentioned, the eligibility is a little bit easier. So you just need your score of over 16. Again, you should be over 18 and not pregnant. And just to reiterate, because I don't think I mentioned it, the Know Your Risk tool could be ending in April, and we're looking to get that extended. But if it isn't, what I would say is if everybody, whoever's interested, kind of do that ASAP. But what I will do, I'll just put a list of the eligibility criteria in the chat as well. Okay.
Excellent. Yeah, that will be very useful. Billy, thank you very much. Nasima, I can see you raised your hand.
Yeah, I just wanted to ask, going back to the programme, is there a weight criteria? Do you have to be a specific weight or can anyone join?
Was that question for Billy?
Yes, so he was just talking about the programme. Yes, please.
Yeah, no, in terms, there is no weight. You don't have to be a specific weight at all.
Oh, okay, because I was approached by my GP I approached the GP about this,
yeah,
and they said that my BMI, so my weight wasn't enough, and so I wasn't big enough to be on the program. So I was a bit.
Yeah. Which area is your GP in?
It's in Hackney.
Okay, because I'm aware that some of our programs, so we have a program called Live Well Newham, and their criteria is based on BMI. Okay. But no, with our program, like I said, with the eligibility criteria I put in the chat, which is more focused on the blood glucose level, weight is not really something that would, we'd look at.
What do I do? Do I just pursue with the doctor? Do I go back to my GP and speak to them and say that?
Yeah, I mean, by all means, you can speak to your GP. What I would advise as well is, do you know your risk tool? I think that's really handy. So if I put a link to that in the chat as well, if you fill that out, it's just really quickly, kind of 2 minutes. You'll be able to refer yourself onto the program.
Oh, that'd be excellent. Okay, thank you very much for that. Thank you.
No worries.
Okay, thank you. So I'll go one by one with the questions. I saw that you've responded to the question on, is there a chart online translating new measures into the old system of 4.5 to 6.5? Obviously, that was difficult.
Yeah, I put that, and that's from Diabetes UK. So there's a little converter in there, so you can put in whichever result you've got, whether it's millimole per mole or percentage, and it will tell you what it is in the either or. I have to say, even as a diabetes dietitian working in diabetes for the last 20 years, I still have to use some sort of conversion chart. I can't always remember what the numbers are. So you're not the only one. Okay.
Excellent. And the question from someone who missed the first part of the meeting, that does the Diabetes Center physicists work and study with other health departments that are prevalently linked to diabetes illnesses?
Well, we are a diabetes service. We all of us, whether we're a nurse, dietitian, or doctor or lay educator, work to best practice. So everything, you know, we work to current guidelines and give evidence based from our professional practice. So certainly as a diabetes dietitian, I'm guided very much about, we have a diabetes support forum, and we're guided by what we call NICE guidelines. So all of us are who work in diabetes, what the best practice is. So in terms of that, that's in regarding to food or medication or anything like that, that is what we all work to. So it shouldn't really be too different wherever you go in the country. Okay, hope that answers your question. And we strive, it's really important that we, you know, for us to maintain our professional practice, we have to work to best practice guidelines. Okay.
Excellent, thank you very much. A resident was asking for more information on steroid-induced diabetes. I'm not sure who will be best placed to respond to this.
Shane,
take that question.
Dr. Mehta, do you want to say that one?
Yeah, so I mean, I guess steroid-induced diabetes it's quite specific, but I guess we do use steroids for lots of different health conditions. You know, patients with poorly controlled asthma or COPD might be put on steroids, and you might be on it for other conditions. And sometimes, one of the potential side effects of that is that because steroids can increase your blood sugar levels, it can sometimes also increase weight gain and cause insulin resistance, which really essentially manifests as diabetes. The treatments that are offered really depend on your own circumstance and why you're on steroids and how long you're on them for. So it's really, really variable. For some people, they might not need any treatment because when they stop steroids, everything might go back to normal, and they may not need any treatment for diabetes. But for other people, it might push them into the diabetic range, and they'll then need to have treatment as any other patient for diabetes, you know, considering metformin, insulin, and the other treatments that are on offer. So it is really specific and depends on your own circumstance, but I hope that sort of answers the question.
Yeah,
Thank you.
I'd probably agree with that.
Thank you very much. Marla B, I can see you.
Yeah, that was my question. And I just wanted to ask, I have been on steroids now for a year. And it's just been reduced from 70 to 35 gradually, but I'm still showing the signs of Cushing's syndrome, and my mobility feels quite impaired because of the myasthenia gravis, which I was given the steroids for. And I'm just concerned about keeping my diabetes as under control as possible. I have been taking my blood sugar every day, but as you say, as someone said, it's just about in the moment. So I'm just wondering what else I can do to control my diabetes. Thank you.
Marla, I was going to say, have you, if you're struggling, have you seen a dietitian or anyone at your surgery? Yes, so, and then perhaps we've sent the referral form. You can refer yourself to one of our to our programs. Perhaps that might be helpful for you as well, just to make sure that you're doing, you know, I appreciate everyone. It is very difficult to give quite generalized, very specific advice on calls like this, because every person with diabetes comes with a different circumstance and has a different diet, has different circumstances at home. And when we give advice to people, it's very individualized, because of course we all eat differently, we all eat different kinds of food, we all have different budgets, you know, and where we like to shop. So it's all very circumstantial. So it'd be good for you, if you haven't spoken to someone, to get that kind of bespoke advice for you, to support you, Marla.
Thank you very much. And Dee was asking for the diet research, a bit more information about the diet research. Sorry, I lost track on.
Well, I can put in a link for our, depends what kind of diet research you have, because diet is very, in terms of diabetes, I mean, a lot of our Diabetes UK do a very nice thing, because of course we understand, so in terms of just general diet advice, as a diabetes dietitian, everyone comes, like I said, from different backgrounds, and we know that no one diet fits one person. So when you come to one of our courses, particularly something like Expert, you'll be talking about different approaches that might suit you. So there's a Mediterranean diet, you might want to do a lower calorie diet, you may want to do a lower carb diet, you might want to do some fasting diet. So it's very different to what works for you. So certainly, maybe 20 years ago we might give sort of general advice, but we recognize that actually not one way suits everybody. So in Diabetes UK website, maybe I'll find that on the link, I'll send you, there's some nice diet stuff on there. But again, I would say speak to a dietitian who can then sort of support you to make some appropriate changes, because what we also do is when you're looking online for things, that doesn't take into account what medication you've got, what you're taking. Are you on insulin? Are you on medication that might cause your blood glucose levels to go too low? Do we need to think about adjusting before we make any big changes? You might have other health conditions that might need to be considered as well. So, it's one thing to go online to have a look, but if you really want to make some real big changes, then do contact your GP to book in to see one of us, and we can try and give you some advice that suits what's happening with you. It may also mean that you might need some adjusting with your medication too. So in terms of research, it's all about not in terms of diet for diabetes. A lot of it is about your carbohydrates and what kind of foods impact your blood glucose levels. We understand that it's not necessary to cut out things from your diet, because it then can cause deficiencies in other places. So it's sometimes going extreme is not always the best approach. So sorry, I've not probably answered the question properly, but it's a difficult one to answer in a short space of time.
Thank you very much.
I'll put a link in the chat box for you.
Yes, thank you. Taiwo, I hope I pronounced your name correctly.
Yeah, Taiwo, that's fine. With me, I've had diabetes since I was 16, and my control was off and on, but recently it's been really, really bad, and I don't feel like I get enough support from my GP. So I just don't know. I'm really struggling at the moment, and I've missed a lot of my yearly annual reviews, because I know what the results are going to be. So I just don't know what to do. Feel like I'm stuck.
So, Tab, in terms of your, you said you're not getting enough support from your GP. We're more than happy to talk to you about it after the event, or maybe tomorrow, and get some more information about your experience. But I'm not sure how you, Dr. Mehta, and Vaya would be able to respond to that in terms of, if the person is not feeling they get enough support from their local GP, what else they can do.
Hi, sorry to hear that you're struggling with your diabetes. And I think one of the things I know you mentioned sort of not missing some of the annual reviews and things like that. And I think that there is every opportunity to sort of touch base with someone in primary care, if there is someone that you connect with that can have some of that initial conversation with you to check what's missing and how we can help in primary care. And I'd encourage you to try and connect with someone in the team. There is also a health and well-being coach in every practice that you may find you may find it easier to access and are more open to having a consultation about how you're feeling. There's also psychology support and other well-being support that they can connect you with should that be needed. So if there's something more specific, we can obviously connect after the talk as has been suggested, but I think that would be sort of some of the advice.
Okay, thank you.
Yes, I'm sure we have your email address registered with us, so I'll make sure I get in touch with you first thing tomorrow, hopefully. And I guess this will be where the next question is: how would I access specialist psychological services? Dr. Mehta, you were just talking about well-being coach at the GP practice. Were you talking about social prescribing?
So there are newer health and well-being coaches in every practice, and I think the idea is that if a patient has particular goals in terms of their health or even outside of health, really, their own well-being that they'd like to focus on, they use a coaching style to really work with patients and clients to achieve the goals that they wish, both in terms of their health and life in general, if it's impacting on their well-being. So it could be quite motivating, and they normally, patients can just ring the GP surgery and ask to book in with a health and well-being coach. And I found that's been really positive for some patients who are struggling with their mental health, or struggling in terms of to find the motivation to take that step to better control their diabetes. So that's one approach. There is lots of other sources of support as well, because we have IAPT for long-term conditions, which is accessible via self-referral for patients who may have diabetes and it is impacting on their well-being. There's support from there. But specifically as well, if you're struggling with your diabetes, as I think Viv flagged as well, we have diabetic nurse specialists and dietitians in every surgery, and it may be that you can book in to see them, and they can connect you with a specialist psychologist that's based at the Hackney Diabetes Centre as well, if you meet the criteria for that. So there are a few options, and I'd encourage you to first and foremost speak with your GP to identify which is the best service for you.
Thank you. Sarah?
So
Yes.
I asked that question. I just want to clarify. I asked the health and wellbeing coordinator who I see to refer me to the specialist psychological help from the Homerton Diabetic Centre. Is that right?
Apologies. So it is quite confusing, and actually I think it's a really confusing space because there are so many options for support, and each member of the team may be able to help in a different way. So health and wellbeing coaches wouldn't generally connect you with the diabetes psychologist specifically.
Okay.
That would be via a GP or diabetic nurse or diabetic dietitian at the surgery. They would be the best way to access specific diabetes psychology support. We can also paste some information into the chat actually about IAPT for long-term conditions, because they can also provide psychology support if that also helps. So that's a self-referral. Patients can refer into that themselves. They don't need a referral at all from a healthcare provider. You can connect with them yourself just based on inputting your information online.
I'd appreciate that you putting it into the chat, because I don't know what that is. IAPT.
I will share that just a thing.
Thank you.
Dr. Mehta, would you know what is the waiting time, the IAPT services on self-referral?
Yeah, so my understanding is that it's very short, the waiting time, and I'm sorry, to define very short is probably I'm having a guess here, but I think my understanding was it was less than 6 weeks is what my understanding of that is. So they do usually contact patients though within the first 2 weeks, and they aim to see them within 6 weeks is my understanding.
Okay, perfect. Thank you. Yes, I don't see any other questions in the chat box. Yes, if anyone has any questions. Yes, Sarah, did you raise your hand again?
I asked before COVID if I could go on the low-calorie diet course with the groups and the support. Has that started up again now that COVID is apparently fading away? You know what I mean? The 800 calorie a day.
Sarah, I think I think it's in Hackney that is being provided by a group of surgeries, and I'm just trying to remember where that is.
So specific surgeries, isn't it? So it's surgeries within Hackney Marshes PCN, London Fields PCN, and also Clissold Park PCN. So apologies if it doesn't cover the whole breadth of City and Hackney.
I'm at Cranwich Road, which is a very Hasidic Jewish practice. They might have been included because there's high rates of diabetes in the practice.
I think unfortunately at the moment, the low calorie diet program isn't available in that area. So it is a pilot and we are hoping to roll out to further practices, but as soon as it is available, and if you are eligible, your GP practice should reach out to you directly to let you know about the service and ask whether you'd like to take part, but it isn't actually available in that area at the moment.
Okay,
So
thank you.
Sarah, if you want to, because we did run the pilot here at the Diabetes Centre, but we can't offer the same support as you would do in a programme because we haven't been commissioned to do that. But if you're at Cranwich Service, if you ask your GP to, is that where you are?
Cranwich Road, yes.
Cranwich Road. So ask your GP to refer you to see one of the dietitians. They can maybe provide you a bit of support in a different way.
Okay.
Because it's difficult to say what we can offer you, and I don't really know your medical background here. So, yeah, okay.
Thank you.
Thank you very much. And we have a very last question here. I'm not sure if we will have enough time to cover it. But a resident, it says a family member has moved from diabetes type 2 to type 1. I don't understand how this is possible because they're completely different with regards to insulin metabolism. Perhaps you could explain. I'm not sure if there was
that's quite a difficult one to answer because we don't have their medical history here. And you're absolutely right. Type 1 diabetes is very different to type 2. Sometimes people think when they've got type 2 and they go onto insulin and they become somebody with type 1 diabetes. That isn't that's not true, because a lot of our patients with type 2 diabetes is a condition where you're, in most people, the insulin production is being depleted over time. So you might then end up on insulin, the very same insulins that a person with type 1 diabetes has. So it may be a slight confusion there. It could be a case that that person has been misdiagnosed. That can happen, but I can't really say, we couldn't really comment on that without really knowing that individual's, again, their history and them looking at their medical records and having a chat.
But the fact is that it can happen.
No, it doesn't happen. You can't have type
no.
2 and then become type 1. Not at
Oh,
all.
I see.
No,
Probably
not at all. People think that when they go into insulin, they become type 1, but no. Lots of our patients in City and Hackney have type 2 diabetes and are on insulin. Could be on tablets and insulin or just insulin, but that doesn't make them have type 1 diabetes. So it could be a query about their diagnosis in the first place, or it just could be that they think they're on insulin, therefore have type 1 diabetes. But I couldn't talk about that person in any individual manner because I don't know their medical history.
Right. Okay. All right. Thank you very much. Thank you to all the speakers for their time and presentations. I can not see any further questions in the chat box. So this will be the end of the meeting. If you have any outstanding questions, feel free to email those to me and I'll pass them on to our speakers today. Thank you all very much for joining. Have a lovely afternoon, and we'll see you at the next information exchange meeting in April. Marla, you raised your hand.
I was just clapping.
Oh, I see. Oh, I see. Okay. All right. Thank you very much.
Just quick question. Sorry, no, just this quick question. You know, for the next meeting, will we be invited automatically, or do we need to sign up again for that?
I will send you invitation. I will send you information in my post-event email to everyone, so you will receive it. Okay. All right.
Thank you.
Thank you very much. Have a good afternoon.
Thank you very much indeed. Thank you.
Thank you.
Thank you.
Thank you.